Greetings, everyone. Happy International Recovery Day. Thank you for celebrating this day, joining us in today's webinar, Enhancing Global Recovery System, commemorating the International Recovery Day. This webinar is held in cooperation with the International Society of Substance Use Professionals, ISSUP, and the Recovery User Network RUN, accompanied by many international experts and international organizations. My name is Elisa Rubini. I'm a consultant with the Institutional Strengthening Unit at CICAD OAS, and I have the pleasure to moderate today's session. We remind all of you that we have Spanish interpretation for this session, and the instruction will be provided in the chat momentarily. Le recordamos a todos los colegas que prefieren escucharnos en español que contamos con interpretación simultánea y las instrucciones para conectarse estarán disponibles en el chat en un momento. I would like to remind you all that we also want to hear from you, and we encourage posting your question in the Q&A button, and there will be time to answer your question during the session. The webinar features an introduction on recovery, which is the heart of this webinar, followed by 3 thematic discussions on topics mirroring the structure of the global position paper on recovery. Without further ado, we are so lucky to have with us today Dr. John Kelly, who is gonna have the opening remarks and some overview on the recovery from the academia. Dr. John Kelly is Elizabeth Spalding Professor of Psychiatry at Harvard Medical School and founder and director of the Massachusetts General Hospital Recovery Research Institute and the National Center on Youth Prevention, Treatment and Recovery, and the inaugural president of the American Board of Addiction Psychology. So Dr. Kelly, you have the floor. Thank you for being with us today and for introducing recovery.
Elisa, thank you. I hope you can hear me okay. Can you see my full screen slides?
Yes, we do. Please go ahead.
You do. Fantastic. Lovely. Well, thank you. And happy International Recovery Day, everybody around the world joining. I'm honored and delighted to be here with such an esteemed group and celebrating this day and helping to get the message out that recovery is real, treatment works, people recover, families reunite, and people lead productive lives in recovery. I am going to give you an overview in the next 7 minutes of kind of where we've come, I think, in the last period of time. Most notably, I've been reflecting on the last 50 years because we've recently reached a 50-year milestone here in the United States since the initial declaration of the war on drugs under Nixon in 1971. This was, of course, mirrored internationally through an update to the Single Convention on Narcotics Drugs, which happened in 1971 as well, all around the world, including signatories signed onto it from 186 countries. Really, that marked a focus, a concerted international focus on, quote unquote, the drug problem around the world. We've learned a lot, of course, in the past 50 years since that concerted focus about how to address people suffering from these disorders, how to best help them, as well as their families. I think initially there was a focus in the United States and in many other countries that was characterized by more of a harsh punitive rhetoric and stance and legislation passed to try and deter use initially to prevent addiction, while working to some degree that has not worked in the way that it was hoped. Concurrently, of course, there has been a growth in our knowledge of understanding about the nature of these disorders. And that knowledge that's been gained through the National Institutes of Health here in the United States, the National Institute of Drug Abuse, the National Institute of Alcohol Abuse and Alcoholism, which were founded in 1970 and 1974, really has helped us all understand kind of the nature of these disorders, why they are difficult to treat, why people struggle in terms of achieving remission. But the good news is most people do achieve remission and stable recovery. I think because of the research, the public health and clinical research that's been produced in the last 50 years, we've gone really away from this harsh punitive rhetoric and stance. In other words, moving away from squinting through keyholes into prison cells through looking through microscopes into brain cells to understand more about how the exposure to substances affects the brain and how we can best address it. We've learned a lot, of course, in terms of etiology, the causes of these disorders, including strong genetic contributions. We understand much more clearly about the neurobiology, how it affects the brain, as well as risk factors in the population that can increase or decrease risk. We've understood also about the pathways into and through and out the other side. And a number of paradigm shifts, of course, have occurred on the treatment side in the last 50 years. I think importantly, we've also learned about just how tough it is to get into remission initially and to stay there. And this timeline really just highlights how long it can take for somebody with one of these disorders to achieve that first year of initial remission. You can see here in the middle, about 8 years after people start to seek help in addicted adult populations before they achieve that first year of full sustained remission. And then another 5 years before they reach the point of being no more likely than anybody else in the general population in any given year of meeting criteria for one of these disorders. So risk remains elevated for many years, even after initial remission. And this is why it's so important to think about not just our acute care stabilization and how we can stabilize people who have these disorders, which is critically important, of course, when we think about withdrawal management and saving lives there, but also how can we create the right conditions, the socio-ecological environment in which people need to exist in order to heal over time. So the question, of course, with this timeline is, can we speed this up? Is this just an inexorable course of the illness, or are there things that we can do as a society to increase the speed it takes, the time it takes to initial remission and long-term stable recovery? I think increasingly we see recognition across federal institutions here in the United States and around the world that comprehensive drug treatment is not just about this stabilization, but looking around the outside of this circle, we can see the other kinds of services, jobs, housing, family services, other kinds of mental health services that people need to be able to stabilize, heal, and achieve remission, recovery, and resilience. We often refer to these days as recovery capital, the kind of array of ingredients that people need in order to recover, both internal and external. I often think about recovery in a similar way to how a diseased plant might recover, that it needs to be placed in the right environment. After all, there's only so much that we can do to a diseased organism at any point in time. If you take, for example, a plant organism, when you place the plant in the right soil, the right temperature, and the right moisture, photosynthesis can occur and the organism can heal. When we think about addiction recovery, of course, very similarly, there's only so much that we can do to the human organism at any given point in time. And that's why I think creating the right conditions can produce a notion of psychosynthesis, whereby creating the soil and the right conditions, we can help the human organism heal. And I think these capture the social environment, the activity, both physical activity as well as jobs and education, nutrition and emotion regulation, can help the human organism. And that's why there's been this focus on, I think, building recovery capital. That is to say, an array of services and facilities that can help support that healing process over those early months and years of recovery. Now, psychosocially, of course, we understand things like housing and jobs and education to affect our psychological well-being and our hope and optimism, but they also affect the neural circuits of recovery, which are compromised through chronic exposure to substances. There's been, therefore, this dramatic growth in services and the variety, very importantly, the different flavors of recovery support services that can attract and engage more people into recovery. That is their flavor, that is their speed, that can support them and attract them. And you can see here the vast array of services. We are also learning more about them empirically. I think very importantly, when we think about the opioid overdose epidemic, the poisoning epidemic occurring here in the United States, one of the things that's become apparent is that it's not just about saving lives, but how do we keep people in remission? This was a nice modeling simulation led by Erin Stringfellow, and I was a part of the team. But what we discovered here was that while things like Narcan, naltrexone, naloxone, and other kinds of overdose prevention strategies can help reduce overdose deaths, what was seen to be the most potent way to reduce deaths was by keeping people in remission over time who are gaining that status of remission status. So the important thing is how to keep people in remission, and recovery support services were viewed to be the most important way to do that. From the federal administration standpoint here in the United States, very importantly, the National Institutes of Health have really started to come forth and put resources into building infrastructure for research to understand more about the clinical public health utility of recovery support services. The National Institute of Drug Abuse has created this recovery research network, which is now around the country, a couple of hundred researchers now working in this area, very importantly. Also, the National Institute of Alcohol Abuse and Alcoholism has put forth a formal definition of recovery, for the first time an operational definition. So these federal institutes are now underscoring the scientific potential of studying recovery and understanding it so that we can amplify recovery and recovery rates. And this is just the definition here put forth by NIAAA. I know time is short and I will end. I just wanted to say thank you. And I will remind everybody that I think at its core, recovery, no matter what we do in the high-tech world, recovery is a low-tech phenomenon. It really is an interpersonal process of building hope and optimism, role modeling, accountability, that we can instill hope among individuals who suffer and their families. I like this refrain from the song Fast Car by Tracy Chapman. She says, "And your arm felt nice wrapped around my shoulder, and I felt like I belonged, and I felt like I could be someone." And that sense of belonging and becoming is so important to communicate and model for people who suffer from these disorders. And I'll end there and hand it back. Thank you.
Thank you so much, Dr. Kelly, for this scientific but also human perspective of recovery, and for sharing us all the history of these past 50 years of the transition and recovery. We are gonna now dive into the topics of these seminars, which are mirroring the global position paper on recovery. We will have 3 blocks, one of each pillar, moderated by our expert. For pillar 1, which is recovery as a strengths-based concept and its goal, I will have Dr. David Best, who is Professor of Addiction and Recovery at Leeds Trinity University and Honorary Professor of Regulation and Global Governance at the Australian National University, and Adjunct Associate Professor of Addiction Science at Monash University, to introduce Pillar 1. David, you have the floor.
Perfect. Thank you so much, Elisa, and it's great to see you and to be a part of this. And I'm really proud to be part of the Global Position Paper Working Group. So this is something that I think is really important. It's also wonderful to hear from Dr. Kelly and have that background. And I'm proud to say that I'm currently in Galway City on the west coast of Ireland, where the purpose of today's meeting is to try and establish Galway as an inclusive recovery city. Why? Because for many of the reasons that Dr. Kelly outlined, the aim here is to create the conditions that maximize the likelihood that an individual will recover. When we talk about recovery, recovery capital, we think of the long-term goals of building up personal internalized qualities and capabilities. But the conditions that allow that to happen, in Dr. Kelly's plant-based metaphor, really are highly important. And the other crucial acronym that guides my work is the notion of CHIME: connectedness, hope, identity, meaning, and empowerment. And I think For me, that applies both as the model for supporting individual recovery, but also for supporting communities that support recovery. That we have to think about, how do we create this global model that allows innovation to be connected, that allows communities that feel helpless to be linked to those that are inspiring and motivating positive change, to create a sense of meaning and purpose around the recovery agenda, and crucially, to empower those who are affected by addiction, either directly or as family members and affected others. So the brief I have been given, and it's a brief, is to review strength-based concepts. And I wanted to start by suggesting that recovery is not just a different way of thinking about things, but a fundamental paradigm shift where we switch from an expert model to a partnership model, which can be tricky for professionals because you're asking them to step from behind their professional roles and masks, and to recognize both the uniqueness of the recovery journey, but also the importance of walking alongside somebody. And the Tracy Chapman quote from Dr. Kelly is a great example of allowing and supporting someone to flourish. And for me, the definition of recovery is fundamentally one about the contagion of human flourishing. The second thing that I think is important about a strength-based approach is we switch from deficits to strengths. Our model is fundamentally about, how do we create a radius of trust that allows strengths to emerge, passions to be explored, and individuals to develop that sense of connection and belonging. Thirdly, I think it's important to say that there is a unique role for peers. While peers will hopefully be active in criminal justice systems and specialist treatment systems, in a recovery model and an inclusive recovery city, they play a fundamental role, because the primary mechanism of transmission of recovery is social contagion, as outlined by William White. And what do we mean by that? What we mean by that is, fundamentally, I want what you've got, and I'll do what you do to have what you have. To create the conditions for that contagion, recovery has to become visible, accessible, and attractive. And it's crucial that our global position paper model emphasizes those contingencies on communities around creating those conditions. Secondly, what that does is it empowers. It empowers individuals, it empowers communities, it empowers families. It also means that we avoid a kind of replication model. What we have to do is recognize the uniqueness of families, communities, and groups, and assert the strengths and create the connections that allow those safe spaces and places for individuals to master their own recovery and then to master family recovery. And I think one of the things we need to do moving forward, and our next position paper will focus specifically on family-based recovery. And the last thing I wanted to say about the paradigmatic change in a strength-based recovery model is it creates the conditions where we assume that recovery is not about returning to some homeostatic zero, but about being better than well. And the evidence is really clear that people in long-term recovery are both more socially connected, more actively involved in their neighborhoods, but crucially, they contribute. Their citizenship and civics is such that recovery is about being better than well. So any measurement of recovery must look at growth, not just personal growth, but family growth, community growth, and relational growth. And contribution, civics, and citizenship are at the heart of that model. We are still in the early stages of exploring what the transition from a deficit-based to a strength-based model is, not just in recovery, but in areas like therapeutic jurisprudence and restorative justice. And it's crucial for us to think of innovative methods, models, and mechanisms that we can capture innovation and capture those astonishing transformations that are characterized not just by individual recovery, but by the emergence and growth of recovery communities. Sadly, I have to return to inclusive recovery cities here in the west of Ireland, so I'm not going to be able to stay for the question and answer session, but I'd like to thank you so much for inviting me to contribute to this seminar, and thank you. Enjoy the rest of the seminar.
Thank you so much, David, for this introduction on Pillar 1 on the strengthening. And I think that we have also two contributors under this pillar, and I would like to introduce Chantal Pepper, who is the chair of the Western Cape Substance Use Forum. So Chantal, please, you have the floor.
Thank you so much for the introduction, and Professor Bess, all the best for your rest of the day. I'd like to also just highlight to everybody that I do work with the provincial Western Cape government, but that is also because we are a developing nation. So everything that Dr. Kelly said, you can only imagine for a developing nation, we literally have to build from the ground up. And I think really it speaks to everything that the recovery movement is saying, the strength-based, model. And the reason why I'm saying this, because since 2012 that I started within this field, when I did the postgraduate in addiction, my mentor at the time said, recovery, you can't speak so much about the recovery person in recovery because, what if they relapse? And that will bring more shame to them. So it was almost like a hush-hush in terms of aftercare and recovery and rehabilitation when I was introduced to the field. However, the legislation, I think, of every country is also critical, which boils down to the policy. So that is where I fit in. I'm the policy implementer of national legislation at a provincial, as well as a local, as well as the community and family level. So if you have legislation which prescribes a bottom-up approach, I think it makes it easier for forums as well as committees, as well as municipalities to adopt that model, and therefore the recovery in terms of what we need to have in place in terms of recovery, you can also understand what you have in place. So like Prof. David Bess said, every municipality is unique. So when you go into a municipality, you literally have to map out what they have, what they don't have. And, most of our municipalities within our province really don't even have community-based treatment programs. So how do you expect someone that is, struggling with substance use, would like to recover, but they don't actually have access to treatment first and foremost? So what does one do then? So what we've become known to do is to be innovative. And this is why I'm so grateful for ISSUP and Unity C to provide this training, like universal recovery training that we did in June, for example. That also capacitates people like myself to take it to the municipalities that have established their local drug action committees within their communities that doesn't necessarily have the treatment yet. However, because of that, we can then identify whether or not we then, focus on prevention, early intervention, treatment, or aftercare and recovery. So that is the continuum of care that we are responsible for. So bringing it back to recovery, whenever you're in the field, you go to the communities, you deal with the municipalities and the stakeholders, and every time they say get sent to an inpatient treatment center, but what happens when they come out? They go back to the same family, the same community, where everything started. We have roughly about 10 in one of our alcohol harms reduction white paper we did research within our communities, and the amount of illegal taverns, for example, within in African context, it's just right. Registration, there's no regulation around it. So someone in recovery coming back to that community, imagine if they just have to go to get a taxi or a public transport, which also I would like to remind everybody, it's not really, as efficient as a developing nation. So just getting to a job opportunity or an interview is really, it is actually so challenging. So imagine just walking back into that community and you've got all this around you. So therefore, we need to create that safe environments for recovery to happen. And this is again, when we said, when people come out, all the community members, the users, the families always go back to, they think that they go to an inpatient treatment center, they come out, or a community-based treatment center, then they think it's like a washing machine model, where they go in, They come out and now they cure. Now everything is they don't need to work with their family relations. They don't need to do anything else. And this is the stigma still that we have to deal with within the families and also the communities. So I think, you know, going back to what David said about the strength-based model is that we need to hold hands. We need to walk with the municipalities, their communities and their families, providing this with the knowledge that we have and I gain through the training with UNODC and other institutions like University of Cape Town here in the Western Cape. We need to start really understanding what our needs of our people are and what strength-based models we can also then pass on to them, and therefore they take up that support structure within their communities. And that ultimately really is what we are struggling with within our communities, is the fact that the families also don't always are motivated to understand recovery. And it's like David said, we need to bridge that gap. We need to take those families, and this is why I'm so proud of our NPO partners. They do include the family within their programs, within their aftercare and reintegration and recovery. So this is what we're trying to do in the Western Cape through the recovery walk we did on Saturday. So only after 10 years, we now understand the importance of recovery. And it was such amusing, and I'll end off here. It was such a powerful, you know, a recovery walk that we did in one of our low to no income areas where gangsterism is rife. It's one of our biggest hotspots in the Western Cape. And, you know, gangsterism is rife in that area. So walking through through that neighborhood with about 500 people, having placards saying that recovery matters, our lives matter, and in those type of areas to decrease the stigma, I think really is what we will then set our goals to do. Because moving forward, I have now dedicated with all my municipalities that have got these structures in place. I will then start educating, capacitating them so they can set up their own recovery networks. And that is how you bring policy back down to the ground. And, you know, that is how we start working with our municipalities, communities, stakeholders, and families and the user. So I thank you so much for this opportunity. I think I'm on time, but yeah, thank you so much. I'm learning all the time, and I'm fairly new in this recovery movement, but I think we've been doing it for quite some time. So thank you so much.
Thank you, Chantel, for sharing all your experience. You raised many points that I think will be picked up during this session. And I'm transitioning now to the second intervention, which is Dr. Kevin Sabet, the President and CEO of the Foundation for Drug Policy Solution. Kevin, you have the floor. Thank you.
Thank you, Elisa. It's an honor to be with so many great folks here on, and of course the attendees. I'd love to share slides, but I'm not a go-to webinar person, but I don't see anywhere I've been trying to do. Does anybody have any hints on how we can actually do that? Elisa, is there a way you can make me oh, here we go. So you just did it. So I think I can do it here. There we go. Let's see. Okay, I think this is gonna work. It's asking me to do a lot of different things. Let's see, okay, let's see. This is not showing anything. So let's try and show something here.
We are seeing that now.
Great, you're seeing this.
Yes.
Perfect, great.
Thank you.
So you see Celebrate Recovery, wonderful. Well, again, it's great to be with all of you, and you know, celebrating Recovery Day is incredible, and it's really, what's amazing is I'll never forget one of the things, I've been lucky to have many mentors, but one of the things Bob DuPont taught me, which is that, you know, addiction is the only disease that you're a better person after you have it than before you had it. And that's pretty incredible. And that's the state of recovery. That's what's amazing about it. And so I'd like to sort of talk a little bit, I don't know, do you see the next slide or you don't? There we go. Okay. Yeah, now it's okay. And now, okay. So in the US, I just did some data. You know, we have about 10% of people report having a significant substance use problem at some point in their life, and 75% of those people, which is an incredible number, the vast majority report being in recovery. And I'm really concerned about how do we get to that state of recovery? How do we get there? Because obviously when we're there, we need to celebrate it. We need to make sure there are, like Chantel talked about, the environmental factors are there. It's very important. In fact, one of the reasons Patrick Kennedy started, many of you know my other hat is wearing Sam hat. You know, Patrick never had a marijuana problem, but the reason he wanted to start SAM with me was because he thought rightfully that his and many other people's recovery are threatened when you see the mass commercialization of any drug. And that was, you know, part of that motivation. So these environmental factors are extremely important. What's interesting that I think a lot of people don't know is that, you know, not everybody in recovery, in fact, about half, actually seek or received in the United States formal treatment. So there are other ways people are getting into recovery besides going into a treatment program. And that is also something that I think is maybe a bit understudied, that we should absolutely be looking at when we think about recovery, is what are the different ways? Because we know that if you did receive treatment, there are many ways that people, even within that group, there are many ways people actually get into recovery. And so, you know, whether it's a group that had formal treatment or didn't have formal treatment, there are, as we hear a lot, many paths to recovery. And when we think about the drugs, you know, these drugs are all interconnected, and it's usually the most available and you know, sort of commercialized and advertised drugs that are actually the ones that people have a substance use disorder with. But we're also often talking about polysubstance use as well. So we hear a lot about recovery is possible, which obviously it absolutely is. One of the surveys I really like on this is the former Canadian Centre on Substance Abuse. Now it's called the Canadian Centre on Substance Use and Addiction, and they did a survey within Canada of people in recovery, and essentially found what many of you already know, probably all of you already know, which is that recovery brings positive citizenship and engagement, and that actually when they surveyed people in recovery, 90+% reported their quality of life as excellent, very good, or good. And over half experienced recovery without a single relapse. Because again, we hear a lot about you know, different definitions of recovery, different definitions, of course, of addiction. And I think sometimes these dichotomies are a bit overblown, you know, disease, not disease, harm reduction, not harm reduction. These are often false dichotomies because people's experiences are different. The human condition is obviously varied. And I think we need to take into account all of those conditions. One of the things that I think we especially need to take into account is this idea to meet people where they're at. But I believe if we're going to have a recovery-oriented thought process, recovery-oriented policy, we're going to meet people where they're at, but we're not going to leave them where they're at. And that, I think, is where we need to make sure we see whatever interventions we're talking about, prevention, treatment, harm reduction, law enforcement, as not standalone interventions. They're actually interventions geared towards kind of the North Star, which for people that have started to use, it's to get them into recovery. And there will be different paths, there will be different, you know, ways, that part is varied, and we can talk about that. But I think we need to remember that recovery as a policy is our North Star. I feel like in 2024, and when you look around, there's a greater recognition of recovery and the importance of recovery. We hear heads of state all around the world talk about it. We hear, you know, the academic literature obviously talks a lot about it, advocates. But I also do worry, and I'm not going to get into this because I don't have time. I'm just going to kind of leave you with a few slides on this. But, you know, we're also at a place where multiple jurisdictions around the world, I think, are passing policies that are threatening recovery directly. And I think sometimes in the recovery movement, we can sort of say, well, that's not really, you know, I'm not really doing policy because I'm, you know, I'm counseling 3 people and I'm working with them, or I'm writing academic papers over there about the theory of recovery, but I don't really want to get into that sort of messy debate. But I think sometimes we have to, because these environmental factors are really central. We can learn from places around the world, and I talk a lot about a tale of 3 places, which, if you can, you know, guess what they are, we have British Columbia, Portugal, and Oregon. Very, very, very different experiences. In some places like, you know, British Columbia, we've had a 4-pillar drug policy, but in reality, you know, just really 1 pillar has been standing. And so they're suffering. There hasn't been the recovery, you know, oriented policy. And so when there's only the 1 pillar, for example, of harm reduction, we often go towards I think policies that really threaten recovery, threaten people's recovery, and we end up having, you know, death rates that are far beyond national averages, death rates that are far beyond even the United States, which is really saying something. And so, you know, I think we need to look at that. When we look at, or people often ask about Portugal, there are a lot of misnomers about Portugal. I would actually say in many ways, Portugal does have in many ways a recovery-oriented policy. And I didn't always think that until I actually went there and, you know, talked to folks and saw what was going on. But culture is also very, very important when we talk about these policies. And so again, we can't do a whole policy lecture here because I want to wrap up, but we often have to take into account culture when we take into account policies, which I think is really, really important. The other side of this that I think is really important is Measure 110 in Oregon. You all heard about it. I'm not going to talk about the sort of outcomes, but I think public opinion is very important to promote recovery-oriented policies. And my worry is that when there are some of these more extreme policies that are implemented, like in Oregon with Measure 110, we really risk major public backlash to actually very sensible policies that have to do with centering addiction as a disease. Because people say, well, wait a minute, if this is what a health approach looks like, for example, Measure 110 or what's happening in Vancouver, then they say, look, I don't want anything to do with it because I feel threatened by the public drug use going on. My kid can't walk down the street without inhaling some kind of smoke from some kind of drug. And so if this is a health-oriented approach, I want nothing to do with it. And my worry is if we go to that extreme, we really risk regressing as a society and going towards policies that are extremely stigmatizing towards the user, which we never want to be stigmatizing towards the user, and also just really focused on things that do not work. So, you know, I think about this idea of total harm reduction, which is where we take into account multiple things: the environment, prevalence, the harm reduction to the user, harm reduction to the community, and you look at all of these things together because it's not a false dichotomy when we integrate the solutions that we know that can actually work. So that's a 45-minute lecture in about 7 minutes, but I hope what we can take away from it is remembering the importance of policy, the importance of culture and the environment, and also the importance of public opinion, which absolutely has a lot to do with where we're going as policy. So I want to thank you all for the opportunity. Happy Recovery Day. It's been an honor to be with you. Thank you so much.
Thank you so much, Kevin, for all these insights, for bringing us to many places and sharing all the expertise that are coming with it. We are a little short in terms of times for the question and answer, but I want to acknowledge how active the participants have been in the question and answer session. There are some common paths, so I'm going to summarize. Many are interested in having maybe the PowerPoint presentation or a selection of them. So please, that's for the organizer and for the speakers. If you can get us the PDF version, we will be able then to publish it along with the recording of the session. I also want to acknowledge that there is a sincere appreciation for the speakers, and there is specifically one question that I want to bring up to the presenters, which is from Nancy Rosencohen. She's asking which strategies can be employed to build and strengthen recovery efforts and connection globally. I think that from Chanel, she was highlighting the importance of the local and how to engage with all the stakeholders that are part of the recovery support. I would ask Nancy to please stay with us because we will have at the end of the session some concrete example of how you can connect with different networks and how you can collaborate globally. I also would like to acknowledge that we received your message, Samra, on your offer to present from your expertise and research work. We will be in touch with you later to see if we can arrange a follow-up discussion on that. Thank you so much. With this, we transition to pillar 2. So pillar 1, we have seen the strength of the recovery. Now we are going to look into the barriers. And I have the pleasure to introduce Molka Nisic. She's the Secretary General of RUN, the Recovery User Networks, and main organizer of this webinar. And she's also research officer at the Center for AIDS Studies at the University of Leicester. And she's going to guide us through the interesting topic of the barrier in recovery. Milka, you have the floor.
Thank you so much, Elisa, and thank you everybody for joining us today. And happy International Recovery Day. So this is a wonderful celebration and recovery successes and strengths and achievements globally to mark them today. But as Elisa said, my task is to begin this panel by addressing kind of one of the preceding aspects of the recovery processes, and that's overcoming barriers. So recovery is far more than a personal journey. We all know it's a complex, multifaceted process and requires supportive environments, inclusive policies, cities, communities, like my previous colleague speaker said. But our pillar 2, which is entitled Barriers Overcoming Obstacles to Recovery, highlights how actually critical it is to recognize these obstacles and also to recognize that they stand in a way of successful recovery and that solutions need to be kind of broken down towards them. And I just want to say a couple of words also about the global position paper on recovery, and to say that for us, this was a collaborative initiative uniting the civil society organizations, NGOs, institutions, researchers. We have a couple of them here, and special thanks to Dr. Kelly and his team from the research and science point of view. But also we have UNODC as a kind of observer to this process, which was developed to collaborative process, including all of these kind of key groups and thematic analysis of the surveys we got. So this was a research paper, and paper which kind of identified the consensus around these 3 pillars: strengths, barriers, and systems. And for us to find a kind of optimized, recovery definitions and practices that are acceptable and that are in consensus with everybody's opinion. So I just wanted to highlight that. And as far as the key barriers are concerned, in our GPPR, we found that they can be broadly kind of categorized into the 4 major areas, and those are stigma and discrimination, access to treatment and recovery services, diversity and vulnerable groups who need to be kind of taken into consideration, and education and awareness policies. So just a few sentences about those. First, we must address stigma and discrimination that persist around both addiction and recovery. And stigma often prevents people to seek help, as we know. And by fostering all of these stigma initiatives and promoting equality in access to community resources, we can create these supportive environments where individuals feel safe to pursue recovery. And second, access to comprehensive treatment and recovery support services is just critical. So it's not only about treatment, like Dr. Kelly said, it's about housing, employment, education, continued health and social support. And only through all of these kind of services and helping individuals to build these lasting recovery capital changes and resources, we can foster belonging to their communities and have people flourish and thrive into their recovery. And the third thing is that we definitely need to pay particular attention to vulnerable and diverse groups, people of color, women, especially women with children and pregnant women, and individuals facing homelessness, mental health challenges, and those in criminal justice systems. All experiences, all of these experiences, they kind of increase barriers to recovery, and tailored services need to be unique to meet all of these critical needs. And finally, not to forget that education and awareness are very powerful tools in kind of addressing all of these barriers, and that by equipping peers, professionals, broader community, and with knowledge about recovery, that will enable stronger, more comprehensive well, let's say support networks and increase the collaboration between all of these services, criminal justice, health services, social services, treatment and recovery providers, and bridge the gap that ensures that recovery is extended to those who most need them. So I'll sum up to say just by addressing these barriers, stigma, access to support, diversity and education, we can pave the way for more effective, holistic and compassionate recovery pathways. Happy International Recovery Day, and thank you.
Thank you so much, Mulka, for this intro on the barrier. We are gonna hear now from Michael Botticelli, who is the lead of the Global Recovery Network. Michael, you have the floor.
Good. Thank you, Lisa, for that introduction. And I'm also a person in long-term recovery, celebrating over 35 years in recovery. So happy International Recovery Day to everyone. And I'm so happy to be on this call with many, many longtime colleagues and friends. So as Mulka talked about in her introduction, the barriers to treatment and recovery really kind of fall into a number of different buckets. And I'm going to put them, she talked about 4, I'm going to put them into 2 buckets. Systemic barriers in terms of what is the ecosystem with which someone lives, but also what are those individual factors around a person that might inhibit access to care and treatment and recovery. And any successful strategy, either on a national or local level, really has to take into account all of those both systemic issues, but also some of those individual issues as well. If people are interested, I can send out the link afterwards. In doing a little bit of research for this talk, I found a really excellent journal article in the journal Substance Abuse, we can talk about the name later, that really looked at the existing research on barriers to treatment. And what they said, and kind of again in keeping with this call, more research is still needed around it, but there are issues that always percolate to the top. And for people with lived experience and people who work with us, I think these will all be familiar to you. As Dr. Kelly talked about in his very first slide, historically, we have looked at this issue as a criminal justice issue and have treated people in a very punitive way and based our policy and funding on those kinds of issues. Many of you know I worked for the White House Office of National Drug Control Policy, and I was the first person to have that role who actually came from a public health background. And it wasn't until the end of the Obama administration that funding for demand reduction, those public health strategies, actually even equaled demand reduction, supply reduction strategies, meaning reducing supply and criminal justice approaches. So clearly, you know, having a public health framework and public health front and center in this is important. As Mulka talked about, lack of access is always at the top of the list. And I think that is particularly acute in rural and remote areas. So how we think about kind of using the internet to expand care, how we build on existing infrastructure to make care more accessible is really important. But access is not just a physical location. Transportation and childcare often can be critical in terms of access to services. So ensuring not only do we have treatment available, but do people have the necessary supports to do it? I will also say this is a policy function. So methadone treatment in the United States, if people are familiar with it, requires daily attendance at a methadone clinic for a significant period of time before people are eligible for take-homes. Very, very punitive. And while there's that help around it, we need to take a look at it. People's ability to pay or have treatment paid for is also a top issue, and ensuring that there are adequate benefits in our healthcare coverage or government funding to access care is critical to what we do. But it's not just any care that needs to happen. We need to make sure that people have access to high quality, evidence-based care. So we need to have systems in place to make sure that our licensed providers and our providers are living up to providing that care. And not only does it need to be quality care, it needs to be the right care. Many of our treatment models are still based on a one-size-fits-all approach. And if you don't fit that model, it's your fault, not the treatment program's fault. So ensuring that we have treatment tailored to the individual is important. And I think that is particularly necessary for people for whom medications have been proven to facilitate long-term recovery. So both for alcohol use disorder and opioid use disorder, we still have a significant gap between those people who need the medications and those people who get them. But also insufficient care. Many of our treatment models, I think it's improving, are still largely acute and episodic. And we need to make sure that people falling off those cliffs are a particular reason, not just for relapse, but as John talked about, significant risk for overdose death. One of the things that is particularly important to me is looking at policies, laws, regulations that might inhibit access to recovery. When we were in Washington, we did an analysis of federal government policies and laws and regulations that present a barrier to recovery. And I think any strategy that you're looking at either nationally or regionally has to start with an analysis of those policies, laws, and regulations that might impede people's ability to get a job, to have housing. And I think that's particularly true for people with criminal records, that we could have many, many laws. So developing an inventory and coming up with a strategy, I think, is really important. And lastly, I'll just say the lack of integration with larger healthcare systems and the general medical setting. Dr. Kelly talked about how do we shorten that time frame between when someone develops a disease and when someone gets into treatment and recovery. And you know, we have, even though people with substance use disorders are high utilizers of other healthcare services, we have a failure to diagnose and intervene when those people intersect with the criminal within the larger healthcare system. And you know, I always say, looking at my own kind of trajectory here, I was the classic definition of someone at risk, but I never remember a doctor or anyone telling me I was at risk or doing periodic check-ins on it. On the individual level, certainly people not ready to stop using. And I really hate that phrase. And I hate that phrase because it, again, puts the responsibility and onus of responsibility on the person with the disease to diagnose their own disease. And again, we don't do that with other disease conditions. And certainly motivation plays a role in people seeking care. But again, to Dr. Kelly's point, I think we can shorten that time frame by staging interventions when people are intersecting with multiple healthcare systems. And that requires us to implement harm reduction and engagement strategies. Here in the United States and around the world, we're piloting low threshold treatment programs where people can come into care regardless of where they are on the continuum. So let's not make the bar so high. Milka talked about stigma. I think we all know the ramifications of that. And she and other speakers also talked about the intersectionality of stigma with things like race and gender, gender orientation and sexual orientation. So how we engage people from those marginalized communities and diminish the stigma is important for us to do. John talked about kind of the social, environmental, and family factors that exist around a person. So things like poverty, lack of educational opportunity, lack of stable housing can play a significant role. So how do we make sure we have those systems that work? One of the other barriers is the impression that many people have that treatment is not successful. You know, part of that reason is not having as visible a recovery community as we would like to have or we need to have. People need to see that treatment is effective in order for them to access it. So even though people who know they have a problem, seeing a successful life on the other side of it is really important. And again, this is very personal for me. You know, when I knew that I had a problem with alcohol and other drugs, I did not see a visible, vibrant recovery community on the other side of it. And I really thought I was going to have a miserable, lonely life on the other side of not drinking and using drugs. And I always say it was nothing could be further from the truth. And I think having, you know, a visible recovery community goes a long way to showing people that they can have a vibrant, meaningful life on the other side of using. And just the last thing I'll talk about is and again, this goes along with the right care and quality care, is that many people with addiction have co-occurring mental health disorders. And I still think our treatment system really needs to continue on efforts to having a co-occurring capable system of care for the significant number of people with a substance use disorder who will have a mental health disorder. You know, when I put kind of this together, it seemed kind of depressing to me. But I do think, kind of listening to everyone today, that we have made significant progress. And I think the momentum is on our side. And I think we have a building movement. I think we have a building recognition. As John talked about, that recovery is not only possible, it's probable, and there are people living it out loud all around the world. So thank you all for being here today, and really happy to be a part of this.
Thank you so much, Michael. And I think that is not depressing. The fact that we are starting celebrating recovery more and more is actually indeed the proof that this vibrant community that you were lacking back in the days is now getting stronger and stronger. So I think we are all part of it, and we are definitely on the right track, in the right momentum. Our second contribution for this pillar is actually a video from my colleague, Jimena Kalawski, who is the Chief of Drug Demand Reduction Unit at CICAD OAS, and we will have her video pull up in a second. She apologized she cannot be with us for conflicting events, but she wants to be with us with the recorded video that we are gonna see. Thank you so much.
Good morning, good afternoon, good night, wherever you are. So my name is Jimena Kalawski. I'm the Chief of Demand Reduction Unit at the Organization of American States in the Inter-American Drug Abuse Control Commission. Thank you so much for having me. I'm gonna present a little about barriers, overcoming obstacles to recovery. I take this opportunity also to acknowledge all the participants who have been writing us to the chat, and they are raising Organization of American States is the most important political forum in recovery, and I think that our countries, Latin American, Caribbean countries, to speak about the issue of drugs. So we have a mandate that is agree with all the countries of the region about the hemispheric drug strategy and its corresponding plan of action. This instrument is very important because define the role that we have in our region, and in respect for the recovery, we have in this document that we have to promote social inclusion with treatment and recovery-oriented approach and reduce inequalities. That is a mandate not only for CICAD, it's a mandate for all our countries. So we have two big units in CICAD that work with recovery aspect. One is demand reduction, that I'm the Chief of Demand Reduction, and the other one is institutional strengthening. Elisa Rubini, she's in this meeting today, works for institutional strengthening, and we have the two different work or mandates. In demand reduction, we have to work with evidence-based treatment programs. We have to work with care and rehabilitation systems with the governments of our countries, and the recovery and social integration with different ministries like health ministries, like education ministries, or social integration in different areas. Also with the support of the civil society, different organizations of the civil society, like Latin American Federation of Therapeutic Communities, etc. And we have to work or provide support to the services for a general population. So institutional strengthening their work in recovery-oriented intervention for justice involving individuals with substance use disorder, about CCM curriculum, and the justice for people that are with drug users and they have justice conflicts, and their work also with social and work or laboral integration. So what are the barriers to recovery in our region? Specifically, you know that stigma maybe is the big issue because it affects women and men, but maybe most important for women because the role that women traditionally have in our families. So also we have a limited availability to treatment or support to recovery programs. Yet we have some countries that they don't have any treatment programs. As you know, there is another social factors that family dynamics, social isolation, etc. But I think in our region, maybe one important aspect that we need to work, we need to have a joint work, is to understanding the problem, understanding the concept of recovery. There is a lot of confusion in our countries what is recovery is. They think maybe it's the same thing that a treatment program, but we need to do more support to understand what is the problem. That is an integral problem when people not only needs treatment programs, maybe they need home, they need food, they need different opportunities to participate in the social life in the community. And the other one is the limited access to resources. In our countries, we have insufficient access to healthcare in general, but more important, there's no sufficient or enough support to access to recovery or treatment programs. So I think maybe these are our most important challenges in our region. And I hope with you to work in this aspect to give more visibility to this aspect of the recovery process in our region. So thank you so much. I hope to speak only 6 minutes. I don't know. Thank you so much for having me, and I think we can share much more about this important aspect that is a recovery process. Thank you.
I think that in the interest of the time, we shorten a little bit Jimena's video. Apology for that. It will be also uploaded and made available in its integrity. So as Jimena was saying about the barriers in the Americas, there are also action towards moving ahead and trying to overcome the barriers. We have seen some commonalities from the American region and other experiences presented by previous experts. Now we really want to go and have a discussion on how we facilitate systemic changes, which is pillar 3. And I have the pleasure to introduce Patton Goic, who is the founder and president of RUN, Recovery User Network. So Patton, you have the floor to guide us towards the discussion of the final pillar. Thank you.
Thank you very much, Elisa. And as one of the organizers, I would really like to express my gratitude to everyone here today attend this webinar. And it's truly inspiring to see a large audience. I see 400 people attending, coming together to celebrate this Global Recovery Day. So basically, I would like just to make some short introduction from our global position paper on recovery. We have emphasized that while recovery holds immense personal strength and resilience, and while reducing stigma is crucial, these efforts will remain somehow fragmented unless we embed them within the broader systematic framework. And often there is an expectation sometimes that NGO will build all these systems from the ground up, but I believe somehow that this approach is somehow flawed. Instead, we need to look at this from the top down, and systems must be shaped by policymakers, guided by the insights and data provided by those who work in the field of recovery. So third pillar of our global paper on recovery is creating those systems. So basically, from all these 50 organizations that gave some input, I would like to mention several statements that we collected all together. So 50 organizations and institutions concluded that recovery requires a collaborative, multidisciplinary approach. And this includes healthcare professionals, therapists, counselors, and importantly, peers and people with lived experience of recovery, all together working with equal status and value. Also, no single institution or therapeutic community or treatment facility can address the entire recovery process on its own. So emphasizing community partnership is essential, allowing us to foster personalized recovery pathways that accommodate individuals' evolving needs. Also, we must improve and support ongoing research and comprehensive program and evaluation that is really necessary to guide and improve these systems. So creating such systems will not only reduce stigma, but will also dispel the myths and stereotypes surrounding addiction and recovery. We often ask ourselves why we fall short. So why do individuals with substance use disorders seems to be caught in some kind of cycle? So entering the recovery process only to relapse. So we know recovery is really not a linear process, but effective policies must support successful reintegration into society as the final stage of the recovery. And this includes addressing crucial factors, as somebody already mentioned, as employment, housing, education, and healthcare. So it's not only about treatment. So balanced and comprehensive state and public policies are really needed to support recovery through early detection, effective treatment, and social reintegration. So these strategies must be integrated at every stage of the recovery process, from harm reduction and early intervention to treatment, reintegration, and long-term recovery management. So one of the really important things is that we must also recognize that the aspiration of individuals with substance use disorders to enter recovery is really legitimate and achievable. To facilitate this, vital revisions are not only important in the policies, but also in the funding, and that are required to establish successful recovery-oriented systems of care that will have results in having more people in recovery and having healthier communities where recovery can flourish. So thank you, Elisa, and I hope that the people after me can speak also something about developing system that will bring us to the recovery. Thank you.
Thank you so much, Boro, for this introduction. We have then Anja Busse from UNODC. She's Program Officer at the Prevention, Treatment, Rehabilitation Session, and she's the person coordinating UNODC Global Project of Treatment of Drug Use Disorder. Anja, welcome. You have the floor.
Thank you so much, Elisa, and welcome everybody. And let me see that I can actually show my screen with you. So with that, happy International Recovery Day, also from all of us at UNODC, and a special shout out also for everybody celebrating their individual recovery this year today. So I will speak a bit about the structural change for recovery, and I'll have a few slides on a policy perspective, as you can imagine, from an international organization, and a bit on technical guidance and the evidence. So let's look at some of the policies over the years. So already when we go back in history, in the international drug control conventions, including the one from '61, there was kind of the commitment that the member states of the United Nations have taken to take all practical measures for, and then including in this continuum of care, also aftercare, rehabilitation, and social reintegration for people with substance use disorders. So the word recovery was not much used then. That kind of emerged more based on the science from the 70s and the 80s. But then in 2016, the General Assembly, where all countries of the world come together, in its outcome document recognized again kind of the importance once how drug dependence and drug use disorders are complex multifactorial health disorders that can take this chronic and relapsing course, and then noted the special role of aftercare, rehabilitation, there you have it, recovery, social reintegration. So, and the Commission on Narcotic Drugs, which is now the policy-making body of the international community on drug policies, has passed a number of resolutions that are prominent and promoting recovery. So, for example, in 2021, you see this resolution 64.3 that again describes a continuum of care and sustained recovery and related support services are very much there. And as you see from the text, is mentioned as needed as part of essential health care systems. So not like as an add-on or a nice to have, but as essential part of healthcare systems. I think that's important to stress. And then many of you will likely have followed that this year the Commission on Narcotic Drugs has passed a special resolution on recovery and related support services, recognizing also kind of that often various cycles of recovery might be needed, and that there is recurrence of drug use disorder symptoms, and that therefore support services also need to plan on a longer term perspective. The resolution also takes an interesting angle because it really, in a way, gives the shout out to what was also just mentioned, the need for recovery really be anchored in public health and social responses, and not only rely on the obviously very important informal services. And this resolution then also kind of notes that in the informal sector, a lot of the care work is done by women, which has also been confirmed by a recent WHO report. So again, this resolution really asks for integrating into essential health and social services in a way also, and public responsibility. So we know, and you might have seen also World Drug Report 2024 that said only 1 in 11 people with drug dependence has access to treatment. In a similar way, also access to rehabilitation services is very limited. Only 10% of countries have reported full adequate coverage of rehabilitation services. And as these are self-reports from member states, right? So we might assume that the situation in reality is even worse. So with that, a bit of the policy framework for sake of time, just to share a bit of you what technical guidance or evidence reviews we have done at the UNODC and with our partners from the World Health Organization. So the international standards for the treatment of drug use disorders, which hopefully you all know by now, describe a recovery-oriented continuum of care, right? So again, like in policy documents, also here in technical guidance, drug use disorders are described as such that often take a course of a chronic and relapsing health disorder. Services need to be planned in a longer-term perspective, but always as needed and at different levels of intensity. And recovery kind of is also described in the standards as a process through which individuals address substance use disorders, actively manage their continued vulnerability to such disorders, and develop a healthy and meaningful life. The spirit of the standards really is that, let's say, we need to protect the health of people no matter where they are, right? And then at the same time promote health including recovery support, so that people are actually enabled and have the resources kind of to address their vulnerability and really have this meaningful, and I very much like the word vibrant, life in recovery. Also to say that we have recovery integrated in the treatment standards throughout the continuum of care, and with the notion that at any stage, whether you're in a community-based harm reduction service, whether you're in outpatient treatment, in a longer-term residential treatment, the recovery perspective should be there, and there should always be a door open to support access to recovery support. So that's very much the idea here, which other than that breathes this idea of public health services, that obviously we need to offer services where they are, you know, most effective, least invasive, most needed, and so on. Coming to a closing, I wanted to mention two papers, one which you already seeded, a scoping review on what actually provides us with good patient outcomes and therefore is important in quality of treatment services. And the scoping review that was published in 2023 identified these three key factors: patient-centered treatment and care, timely access to services, and, speaking in the direction of our webinar today, the importance of continuity of evidence-based substance use disorder treatment services. And maybe also to say, you know, because many of you have mentioned also the role of recovery in overdose prevention, that while the recovery resolution this year was so widely acknowledged, there was another resolution passed on overdose prevention this year at the Commission on Narcotic Drugs, which very often and prominently also mentions the role of recovery support in this regard, with a view to reducing mortality even. The other paper or publication was done by our colleagues at the World Health Organization that did this evidence review for their mental health gap action program and answered the question if in adults with drug dependence, recovery-oriented services are effective. And they based their recommendation on 25 systematic reviews, recommending, right, so the recommendation is there, that recovery-oriented service on a voluntary basis should be considered for adults with drug dependence. And then they kind of identified interventions that have slightly stronger evidence support, such as case management, long-term residential and continuing community care approaches, occupation-based therapies, peer support. We nevertheless have to acknowledge that the strength of the recommendation here is still conditional because the certainty of the evidence is low. So that's kind of a call for action for all of us, right, to continue evaluating, documenting, and researching what really works. So in the framework of our joint program with the World Health Organization on drug dependence treatment and care that was started in 2009, we included again from the very beginning the need for essential services that include and are developed in a recovery-oriented continuum of care. And this motto emerged on nothing less than what's expected for the treatment and care of any other, especially chronic, maybe relapsing health disorder. And I think that's really something we should go out and demand, right? That nothing less, and maybe sometimes even a bit more. And with that, thank you very, very much for the opportunity. Learned a lot, and yeah, over to you, Elisa. Thank you.
Thank you so much, Anya, and thank you also for sharing all this very interesting publication. I think we will collect all this information to provide maybe direct link so the participants can, after the webinar, go and review many of that, because checking also on the question, there is a strong interest, and I also thank Adam Scheffler for sharing additional research on recovery, which are undoubtedly useful for building up more knowledge and evidence. I turn over to our second contributor for this pillar, and sorry for butchering your name, which I'm sure I'm gonna do, Zeljko Petrovic, Assistant Director for Drug Policy and Addictive Behaviors at the Croatian Institute of Public Health. Zeljko, you have the floor. Thank you.
Thank you for the floor, and also thank you for giving me the opportunity to share with you the creation experience with the project of social reintegration for persons with drug use disorder. Actually, I will very briefly present the project, main activities of the project, evaluation process, and what we have in plan in the future with the project. The project of social reintegration was started and actually it was adopted 2007. It was 17 years ago. The reason in that time why we start with the project is that that a large number of persons with drug use disorder, even or after successfully completing drug treatment, returned to addiction lifestyle again. Actually, that was a lot of relapse. And also we recognize that they are often unable to successfully integrate in their social environment. So there is many reasons for that. Some of them already mentioned. One of it was the public opinion stigma, and also there is not insufficient family or wider social support to them. So we think about that and recognize that reintegration should be integrate part of the treatment and psychosocial rehabilitation process. The project already mentioned, it was everything started 2007, offer services from different stakeholders, and the services, the most important things, are funded from the state budget. Actually, the services are professional skills training, primary and high school education for persons who are in drug disorder rehabilitation programs or have completed one. Also, there is the program of psychosocial supports, assistance in social life skills like housing and employment. Of course, we're monitoring the project by yearly report about that, and also 2014 decided to evaluate it, the whole project. And project evaluation outcomes was that general assessment of the project is positive. This is the most important. The project contributed to the better reintegration into the community and also encourage education and reduce stigmatization of persons with drug use disorders. Of course, there is something what was missing that time, and there is also some recommendation from evaluation. Some of recommendation was that it's necessary to establish the group in the community that will be support during the recovery process. Also, it is necessary to advocating among beneficiaries possibility offered by the project. Sometimes people doesn't know about the project or doesn't know what can project offers to them. And also one of recommendation was offer occupation adapted to the work and medical abilities of client. And actually, the one of most important things that we try to find a job to them, but they cannot accept any jobs what was offered and the markets. And also, one of the recommendation was more focus on vulnerable groups. Reintegration and recovery priorities are part of our national strategy. There is also a part of our new strategy, which was adopted 2023. It was the first coherent strategy in Croatia, which means that this strategy actually accepted it is not only for the drugs, but also it was strategy for the alcohol, for tobacco, and addictive behavior. It was addiction strategy. But good things why it's necessary that recovery and reintegration process must be part of this strategic document is that is ensure the stable financing of this model of the project. It was financed from the state budget. So,
Zeljko, may I ask you if you can wrap up the conclusion in 1 minute, please?
Yes. Now, actually, what is the most important things what we have to do in our future plan, and also that will be the conclusion. Actually, the conclusion that the project has contributed to better inclusion in the community, but also I like to mention the revision of the project as our plan, our future plans for 2024. Actually, we will expansion of intervention for the people who have addiction problem, not only for the drugs related problem. Also, we will try to develop special program for targeting groups, women and minors. facilitating the accessibility and involvement of user in the project without additional administrative obstacles. Sometimes these administrative obstacles are a huge problem. Provide interventions that are in the line with the needs of the individual clients. Ensure integrate social intervention like schooling, education, healthcare, counseling, etc. So I would like to thank you all for this opportunity to talk, and I also wish you a happy recovery day. Thank you very much.
Thank you so much, Zeljko, for sharing with us the creation experience, 70 years. It's really a long trajectory. We wish you all the best in continuing these efforts. You are among the pioneers. In the interest of time, since we are closing to the end, I would like to give the floor to Matej Kozir. He is the chair of the Vienna NGO Committee on Drugs, and he has some remarks for us. Matej, you have the floor.
Thank you very much, and happy International Recovery Day to everybody. It was interesting to hear all presentations. I wrote a lot of notes, so probably I won't be able to go through all of them. But for those who don't know me, I'm current chair of Vienna NGOC, Vienna NGO Committee on Drugs, which is an international global platform of civil society organizations. And we have more than 400 members in more than 100 countries. And many of our members and NGOs work in the field of recovery. And in some countries, NGOs are the only providers of recovery services, similar to prevention and harm reduction, in the field of prevention and harm reduction. And it shouldn't be like this. So as we heard, all those services should be integrated in one system, connected to each other, which we would also like to, which will be also advocate in the future among civil society organizations. Also, we heard that in last decades, recovery is getting a momentum in global drug policy, which is great. It gives us more opportunities to talk about recovery, to promote evidence-based recovery services, and do some advocacy as well at the national and regional level because of these all global documents which are available to member states and also civil society organizations. And also we know that knowledge and skills are extremely important, and we are very much proud of our members, ISSUP and ISSUDDR, with help of United States State Department and INL to develop universal recovery curriculum, which will definitely bring better knowledge and skills to recovery workforce in the future, also among civil society organizations. We also heard in our discussion that recovery starts much before when most of people think. So it's important that NGOs and other providers are aware about the importance of recovery and connect their services, prevention services, treatment services, harm reduction services to recovery services as well as soon as possible. So this is that we follow this approach of continuum of care in all segments and in all phases of this continuum. And also, it is important to know that the recovery is becoming more a community and multi-sectoral approach. And we know that many community stakeholders should be involved in this process of recovery, such as health and social services, housing services, employment agencies, education institutions, leisure settings, local authorities, law enforcement, businesses, NGOs, and many others. So this should be a community approach. So everybody in the community is at least partly responsible for better recovery outcomes at the end of this process. And to conclude, I think it's very important to highlight the importance of, as well as in other services, that we should provide only evidence-based interventions, which are evaluated and we know that they work. We also need to provide sustainable funding, including for NGOs, which provide recovery services. And we should also monitor and evaluate our work, because without monitoring and evaluation, we have no idea if we are successful or if we are reaching our expected outcomes. And of course, at the end of this process, we also need a supportive political environment, like policy measures, much wider, not just from the perspective of supporting recovery and the funding of recovery, but also other related sectors, which I already mentioned, such as housing, employment, leisure settings, prevention interventions, and so on. So with this, I would like to conclude, and thank you very much for giving me this opportunity to give a closing remark of this very valuable webinar. Thank you very much.
Thank you so much, Matej, for both doing the NGO statement and the closing remarks. Before closing the webinar, we also want to have a shout out for a call for action, and I would ask ISSUP colleague if we can project this one summary slides with some concrete action that you can do if you are interested in learning more, joining more the network on recovery. There are two exceptional networks. One is RUN, Recovery User Networks, who is the very heart of how all this started many years ago. And there is also another opportunity with the Global Recovery Networks, which is an initiative of the Global Coalition to address synthetic drug threats. And here we are going to present the two QR code and the direct link to connect with both network if you are interested to do so. We also present, I don't see that on screen, but I hope other colleagues are seeing that, the QR code to access the test, and if you want, after reading, you can also sign. There is also another important tool that was mentioned in today's session that I want to highlight because it's not in this QR code, that is the URC, the Universal Recovery Curriculum, who has been developed and is available on the ISSUP website in two versions. There is the peer for people who have a lived experience, and the allies for all the professionals and community who wants to support recovery globally. So with this, this is a call to action. I'm so grateful for all the excellent presenters, both as individual expert and institution who has accompanied this webinar in celebrating the International Day of Recovery. Thank you to all. I'm not going to mention everybody for the sake of time, but it's always a pleasure to be with you. And I think that we are looking for more recovery in our community with individuals, with professionals in the continuum of care, and doing more of the presence of recovery, celebrating the success of people with lived experience and how they can contribute. We started many years ago with the word recovery, then we transitioned to recovery champions. What we need now is recovery leader who can help us in the transition to empower recovery worldwide. Thank you so much. Happy Recovery Day, and see you soon.
Thank you.
Thank you, Elisa. Bye-bye. Thanks,
Thanks,
ISSUP.
everybody.
Everyone.
Thank you.
Great stuff. Thank you.